Hi, I'm Dr. Devyani Barve. I'm a plastic and cosmetic surgeon and I practice in Mumbai. We see a lot of patients who have gotten injured or who've had an accident and who come in asking for plastic surgical correction for their injuries. These can be kids who've had a fall and got hurt on their face or their hand somewhere, or an elderly person who maybe had a fall at home. Or it can be something as major as an accident in a car or a fall from a building or something like that. All these cases may need some kind of plastic surgical intervention. So in this video, I'll just give you a few pointers on what to do to take care of your wound and how to manage it best to optimize your healing. If it's a small cut or a wound which has happened because of a small injury, such as getting hit by a chair or at the edge of a door or the edge of a table, and which has been sutured or surgically stitched, then the care is fairly simple. For the first 2 to 3 days, we prefer to keep these wounds covered so that the moisture within the wound and the protection from the surrounding dust and dirt gives it the best chance to heal. After 2 to 3 days, the wound is sealed by itself and is impermeable to the surroundings. So after this period, if it's a child, we keep it covered with a waterproof dressing so that the child can go to school or resume his daily activities. If it's an adult, we can sometimes cover it with a surgical tape so that it stays protected from dust. At the same time, it keeps getting stronger day by day. However, if it's a wound where there has been a loss of skin or the skin is not healthy, then we have to do regular dressings. Every 2 days or even every day, the wound may need to be cleaned and covered with a sterile dressing and with a strong tape or a waterproof dressing. These wounds are fairly simple to take care of, but you should show your surgeon every few days so that they can clean the wound surgically if required. If it's an open wound where there has been skin loss, important is to keep it moisturized. So we use gel-like ointments which help retain the moisture in the wound. There are a lot of advanced dressings also available which can be provided to the patients, which are easy to apply just by tearing off a film and sticking it on the skin. These make your wound waterproof and you can even have a bath over it. A lot of patients are worried about how the scar from a traumatic wound will look. So that really depends on how the wound took place. What was the injury? How long did it take to seek medical attention? Whether there was any infection or not? And what is the nature or the shape of the wound? Generally, linear and simple wounds heal well and barely leave a mark. That's why patients ask for a plastic surgeon's opinion when they come to any hospital. If the wounds are larger, have loss of skin or fat or muscle, then the scarring will be proportionately more. In these cases also, there are a lot of ways in which we can improve the way the wound will look eventually and give it the best scar. So make sure you take care of your wound right from when it happened. Make sure the wound is cleaned, it is covered when you come to a hospital. Once your wound has been treated or sutured, make sure you follow the instructions. Don't leave the sutures unchecked for a long period of time. Make sure you do your follow-ups well. And if your wound is such that it needs a daily dressing, try and make sure that you don't skip dressings, because that is what will prolong the healing period and will prolong the scarring which goes along with it. So I hope you found this video helpful to take care of your wound using simple tips. Thank you.